Yes, I was saying reintegration is the same as with any normal illness. Once someone has been declared negative, there is no follow-up, they're free of the disease, they're free to continue with their normal lives.
Daktari, we have been sending a few questions. I don't know if you're able to see the questions so that you can respond to them.
Okay, let me see. I'm not able to see.
Yeah, I think there were some questions that were posted before we were thrown out. There was one observation. Say, what's the outlook and what's your projection on how long this situation might go?
Okay. Given the history of other pandemics, we have concluded that most pandemics come in waves, meaning there's always the first wave of infection and then that resides and there's a possibility of another. This depends on how we handle the first wave. Right now, we have and we have started mass testing. Of course, as we lift the restrictions with time, as we lift up the restrictions, we could have a new cluster of cases. So my advice generally, as of now, as it stands with the evidence that we have now, is that we have a new normal that we have to adjust to. So this social distancing could go on for quite a while before we have total control.
Good, thank you. And I think there was another question saying, is there hereditary link with psychiatric conditions?
Well, a hereditary link to psychiatric conditions.
Yes.
Is that the question?
Yeah, I think something like that. I didn't quite capture, but somebody had posted it on the wall.
Okay. Yes, yes. In fact, most major psychiatric illnesses have a hereditary link. They have been shown to reside in genetic pools. And so that is one of the reasons. The other one can be induced by a secondary agent, such as drugs or exposure. Like, for example, when we're treating such illnesses, it comes to a point where we may be forced to use steroids. This can predispose to psychiatric manifestations. People also who have a low threshold of uncertainty could come out of this with something called post-traumatic stress disorder. So it's not something that has to be in the family really, but yes, most psychiatric conditions have a genetic yes, someone could be predisposed by genetics.
Good. Yeah, I think the participants, you can continue to post your questions on the wall even as we continue. There's one more. You talked about health. You know, people can go back and seek help maybe in hospitals. Are there support groups where they can, in societies or even associations, organizations in the country that really support around mental health?
About mental health, yes, yes. There are support groups in the country. Most of them are even, they have social media presence depending on which condition one wants to follow up on. There are societies, whole societies such as the Kenya Psychiatric Association and the Kenya Psychological Association. Unfortunately, mental health has never been mainstream in Kenya. So this is when we are trying to plug those gaps. But yes, there are support communities of support.
Okay, so the other question is, how is voluntary testing working? And how
Okay.
easy is it?
So basically, voluntary testing is where we set up mobile labs and people walk in, and two types of tests are done. We have a swab, that thing that looks like an earbud. So we get two samples, one that we get from the mouth and the other one from the nose. One is advised not to blow their nose before, because this tends to affect the results. The reason why we do two swabs is because it increases the sensitivity, which basically means it increases our chances of getting the virus if someone has it. And the whole point of testing is because we want to know who is sick, so that now we can quarantine them and then consequently be able to lift off some of the restrictions which have been put.
Possible is this? Is it very easy to just walk in and have your test done? How easy is it?
Yes, yes,
The
yes. It's
government
possible to
facility.
it's possible to just walk in and have a test done. But of course, these are only found in places which have been, the targeted testing has been installed. It doesn't mean it's found everywhere. Like now, there are certain estates which I know the government has put mobile labs for that kind of testing. Unfortunately, you cannot walk into a hospital and get the same kind of tests, because most private hospitals, one has to pay. And in our institution, we are not offering tests on an outpatient basis. But yes, most centers, you just walk in and get tested.
Hey, Dr.
Yes.
Wanted to also find out, I know you're working in a health facility. How do you manage the anxiety of the health workers? Because I think they are not all the same. They could be having different feelings and anxiety. I don't know how you have managed them so that they can easily work and manage the anxieties there.
Yes, as of now, the only thing we have is a debriefing, where after someone has done rotation in the isolation ward, they are able to sit down with someone and talk of their fears. But also, again, I talked about the optimism bias. Most health workers have a feeling that themselves cannot be infected. I don't know, it's good and bad. Good because that means they are not afraid to go to those isolation wards. Bad because also that kind of attitude predisposes most of us to actually get ourselves into very threatening situations. But the only thing we're doing is debriefing. We haven't had any other mechanism.
I think there's a question. Phyllis Kair was raised her hand. She can unmute herself and then ask the question.
So I'm seeing a question from Nelly Ngogi, if there's counseling in our health facilities. Yes, there is. Unfortunately, it has not been put as part of the policy, but if you walk into a facility and ask for counseling, yes, there is.
Hello, Dr. Ali.
Yes.
Thank you for the awesome presentation.
Thank you.
Yes, it's very, very informative. I was wondering, you said that this situation may may take
Sorry?
many.
Yes.
You have a rough estimate, and I'm also concerned about candidates. What will happen to candidates?
Okay. It's a catch-22. Why? Because we know that this is something that is easily transmissible. Even people who are walking around with no symptoms could be having the virus, and they could as well transmit it. So as of now, the estimates are we could go on like this for a year. As of the candidates who are going to sit, who are due to sit exams, unfortunately, with the way things are now, if we don't get to a place where the curve is flattened, then that means we may have to postpone exams. Why? Because initially we thought, it was widely believed that this virus did not have an effect on children. In fact, most children who were kept in quarantine facilities never developed disease, and for those ones who did had mild disease. But then we have come to countries like the UK and the States having cases of something called hyperinflammatory syndrome, where after the infection, these children, they develop another sickness, which is related to which is a consequence of the infection. And this has actually been shown to affect the heart. So because of this, even children now, while previously people are being told not to give them masks, now we are considering giving them masks. I don't know, in some countries they're already putting the children in masks. I've not seen it as a policy here in Kenya yet, but I know with the updates, we'll get a way forward.
So that sounds like we'll actually, we are in this for a long haul,
Yes.
even
yes.
having kids at home and preparing for the exams. That's something to watch.
Yes.
Any other question? I think the participants are free to unmute themselves and they can ask any question.
I'm seeing a question from Helen Wachera. Yes, there's a plan for mass testing. It has actually begun.
Do you know how this will be done?
Yes.
Do you know what is the plan for mass testing?
I can't hear you very well.
Do you have an idea how this will be done, carried out?
Yes. So what they're going to do is delineate estates. So first they're starting with the hotspots where they think there could be a cluster of cases, and that's where they are mass testing first as they spread out the program to the rest of the counties and, yes, the estates. In fact, there's a survey that has been doing rounds on PDF that shows the places where the mobile labs are to be set up at any particular time. There's a question I saw. Yes?
Will that be compulsory?
It will not be compulsory. As it is now, it is not compulsory. It's voluntary. But everyone is encouraged to get tested. So I've seen a question on the predictions for coronavirus. They've been well behind the curve, but as you're seeing now, just as the other countries, the numbers are growing exponentially. So in terms of predictions, we're still far behind, and some of the predictions which had been made were macabre, and we thank God that we're not there, and we'll probably not even get there. But yes, there is an exponential rise, and we should expect the numbers to go higher. but not as per the predictions.
Maybe another question, Daktari, is on the testing capacity. Initially, initially there was talk that we actually had not built that capacity to test quite a number, and the government had given itself a target, I think, of 250,000 by end of June. What exactly is behind this low number of tests that are done daily? I think we've hardly surpassed 1,500, 2,000 thereabouts, and yet we anticipated maybe we should be doing far more than that. What's shifting these numbers?
Well, initially we had infrastructural challenges because we only had a few institutions which were able to run these tests, and all of these two institutions, which were the National Influenza Center and Cambridge, they were using manual assays, which basically means that they were doing these tests manually. So initially, that's why we were doing a very conservative number of tests. But now other institutions have been accredited, and we have been able to get the electronic assays, which can do up to 200,000 tests per day. So we'll see an improvement in the number of tests being done. Also, because we had so many cases and there were only two institutions initially, the time it took, the turnover time to get results also took a number of days, which is now decreasing. So going forward, we'll probably be getting results in a matter of hours. As it is now, we are getting it in a day. We are getting results in a day.
Good. We should almost be coming to the end. Any other question, observation from the participants?
There's a question from Phyllis Cairo.
Okay.
She asks, I'd like to know what is the one symptom which, if you see, you should be concerned? We keep getting our temperatures checked every day, and I notice mine oscillates between 34 to 37. Is this normal? On isolation centers, where can we get information on which ones have been set aside?
Okay. In terms of what we have observed to date is the two most common symptoms have been fever and cough. Now, fever is subjective because even for me, my experience in hotels, not hotels, supermarkets, is when they have this infrared thermometer, it tends to give very extreme figures of 34. One cannot sustain life with 34 degrees Celsius. In fact, the normal temperature range is from 36.5 degrees Celsius to 37.5 degrees Celsius. So at 30 degrees Celsius, we consider someone extremely sick. And also at 38, the same. So at this point in time, in my own opinion, I feel that these infrared thermometers are not as sensitive, and I feel that they are affected by also the environmental temperatures around. So the one symptom I would put across that would raise suspicion is an unremitting cough, an unremitting dry cough. That would be the one symptom, but also the lethargy, fatigue, muscle pain that is non-specific should lead someone to a hospital. For children, it has been shown to be shed through diarrhea. So also for children, diarrhea would be something to screen.
Good. Oliver, any other question?
Yes.
I have another question.
So yeah, we're almost coming to 7:30. Oliver, kindly enable me to share the screen. So as we end, once again want to, yeah, there's a question that is coming through. In supermarkets, I guess there are a lot of fake infrared thermometers in Kenya. I don't know. It sounds like more of an observation. I don't
Yes,
know whether
I
there's
also,
any guide on those infrared thermometers.
yes, I also concur. Most of this, in my experience, most infrared thermometers don't give a reading that is trustworthy. In fact, yesterday we had a patient who was clinically febrile. They had a fever clinically. You could see it, you could touch it. The patient was sweating. But then if you test using that infrared thermometer, it was telling us that the patient had a temperature of 36.2 degrees Celsius, which was a lie. So anecdotally, yes, I support the fact that these infrared thermometers, most of them, they're not dependable.
Mhm. Good. So as we come to the end of this session, we just want to share what as IELTS Group, we are actually a HR consulting group. We are based out of Westlands in Nairobi, and during this time when we are working from home, the situation is as it is. We've actually been trying to put together topical issues, topical areas of discussion, and inviting experts just to help us, even as we are at home, we are pondering on what to do next, to be able to do some virtual sessions like we've had today, which I believe has really, really been very beneficial to all of us. So we even at this time, we can support organizations. If you are running an organization and you don't know in terms of then what next, how do you assess your organization readiness for the next, for the new normal? How do you redesign your organization? Building the necessary skills for the new normal, reviewing strategies, reviewing policies, reviewing plans. We can always come in that space and discuss with you, see how best we can work jointly and deliver an intervention for your business continuity. So you can always drop us a message at our email address is info@ieltsgroup.co.ke, and the cell phone is on the screen. So anytime you can always reach us and we can engage, we can talk how to partner more even as we go ahead. And I think to that point, I want to just open it up to, as we drop off. Again, before we drop off, I want to say thank you so much, Dr. This has really been very informative.
Thank you very much.
Very useful. I'm sure we can always come back to you again to share some more thoughts, some more insights on this particular space, even as things start to develop going forward. We are really, really grateful that you accepted our request. And for all participants, thank you so much for dialing in, for finding time this evening. Let's stay safe. Let's observe the Ministry of Health guidelines and really help to flatten the curve so that we return back to normalcy. So I just want to open it up, for all the participants. If you can just mention where you are dialing in from, your name and where you are dialing in from. Just quickly before we close.
I'm Elijah B, dialing in from Bomet, Tembe Hospital.
Thank you, Elijah.
I am Edith Morogo, dialing in from Nairobi. I work with an NGO called Center for Domestic Training and Development. We run a girls' shelter, and we have comprehensive programs for domestic workers. Thank you.
Thank you, Edith. Welcome.
I'm Nelly Ngugi, dialing in from Nairobi.
Thank you, Nelly.
Charity Kirui, dialing in from Nairobi.
Thank you, Charity.
I'm Sheila Siele, dialing in from London.
Oh, thank you, Sheila, and keep safe.
I will, thank you.
I'm Griffins, dialing in from Kericho.
Thank you, Griffin.
Daisy, dialing in from Nairobi.
Thank you so much, Daisy.
I'm Kate Gitau, dialing in from Kiambu.
Thank you so much.
I'm Helen, dialing in from South B. Will it be possible to get a recording? Is it possible to get a recording of this session?
Yes, it is. I don't know if you can kindly drop your email address, then we can actually share the link of the recording. It will be available.
Okay, thank you.
Thank you, Helen.
Hilda Maina, dialing in from Nairobi.
Wow, Hilda, thank you so much. Thank you. Good. Anyone else? Otherwise, you can. I think hopefully all of us have actually mentioned their name. So my name is Ben Sele. I'm the managing partner for the ALF group. Currently, I'm in Kericho, but normally based in Nairobi, Westland. So again, thank you so much. We're now coming to the end. We are setting up another session next week around the same time. So please be on the lookout. We'll be posting the topic and the link very soon in our social media platforms. Please join us and be part of the audience and the participants. Again, thank you so much. Be blessed and have a great evening. Asanteni sana.
Thank you.
Thank you.
Thank you too.
Thank you.